There were 3 patients that did end up needing to go to the ED.
At this Toronto hospital, Dr. Justin Hall checks in with a staff member from the virtual emergency department.
This is a great service for those who have minor injuries, minor skin conditions.
And put your finger.
The online service started during the pandemic with emergency physicians. Now it's led by nurse practitioners with support from doctors.
We are not a solution to the primary care crisis. We are, however, a way of bridging the gap.
Emergency rooms across the country are under pressure and face staffing shortages and closures. But a new study suggests those virtual appointments had little effect on how many patients showed up in person at the ER. Researchers looked at data from more than 19,000 patients in Ontario who had a phone or video call with a healthcare provider during the pandemic.
Many of these patients had visits on the same day with another healthcare provider.
Among those accessing virtual services the most, young adults in urban settings from high-income neighborhoods, and 85% already had a primary care provider.
In a system of strained resources, we can't afford to provide redundant care to a population that already has good access to care.
What are virtual visits?
Health experts say virtual care is effective in some cases, such as for children and those living in rural or remote locations, or for people without a family doctor.
A fair number of the people who are coming to the emergency department don't have access to a family doctor, and so essentially they're using it for primary care.
Healthcare providers say virtual care is here to stay, and if used effectively, can play a critical role in helping Canadians get the care they need. Tashana Reid, CBC News, Toronto.